and then I would add an antipsychotic to treat the psychosis. Um,
What would you add?
well, it's a little difficult because I'd be worried about weight gain for him. Um, there isn't really one that's approved for that I'm aware of for psychosis related to major depression. My most likely pick would be Ziprasidone.
Why would you pick that?
I worry about weight gain. I just worry about weight gain and more metabolic type symptoms, and he does have some hypertension and get an EKG, but
Why would you get an EKG?
just to check his QTC interval, and because of the Ziprasidone, get a baseline, be sure it's not prolonged on baseline.
What would a prolonged QTC look like?
450 microseconds or greater.
And what dose would you start him on, and what would you tell him about starting the medication?
I would tell him that I'll start him on 40 milligrams, and he'll take it at bedtime. It actually might help him sleep initially. He's been reporting having poor sleep. And then a little bigger, maybe I'd go to 60 just to be sure I'm at a therapeutic dose.
What is the therapeutic dose of?
I believe the official range is between 40 and 80 milligrams. People do push the dose to 120, 100.
You would have him take it at bedtime to help with sleep?
Yeah, it can be helpful for sleep, in my experience. That doesn't work well enough. I mean, I might want to still work on helping his sleep, but honestly, his sleep pattern sounds like it could be disrupted based on the computer use as well. So I would definitely want to get a sleep history and have him maintain a sleep log for a little while just to be sure he's not intentionally disrupting his sleep. Not intentionally, but through his behaviors disrupting his sleep.
Other than the psychopharmacology, any other things that you would recommend for this patient?
Mm-hmm. Yeah. I would recommend that he has a therapist. And at this point, I feel like a supportive therapy would be most helpful in trying to get him back on his feet. When he's
Why supportive therapy?
Well, I think he's down. He's very depressed. He would do well with kind of active problem solving on how to get him back into at least looking for work when he's feeling better, what kind of work he'd be interested in, kind of foster some future-oriented problem solving.
So if you were doing this therapy with this patient, what would that look like?
Well, I would start by asking him, what is his opinion of all the time he spends on the computer? He obviously enjoys it, but does he feel like it's too much or too little? Is it just right? Try to get a sense of where he's at currently before I start asking about, well, maybe trying to get him to realize that although this might make him feel better, it's not necessarily in his best interest to continue to be that withdrawn. On that angle, I would like to get him involved in some sort of social group. That's not online. See if there's any other interests that he might have had that have dropped off that maybe he could restart.
What are the strengths in this patient that you're going to be pulling on in supportive therapy?
Well, he seems to have pretty good insight. He has at least started treatment. He doesn't seem to be particularly impulsive. So I think he sounds like somebody who, when he was feeling better, was a planner type person in terms of his work with the computer and accounting and so forth. So try to foster those skills again.
Anything else? Actually, let me go back. You said you wanted to get him involved in some sort of group. How do you think this patient is going to function in a group setting?
Well, a group therapy I think might be a little problematic in terms of, I wouldn't necessarily, but something around a certain interest would be more. So there are sometimes these gaming places, cafes. Have him go there. I think that would be a good fit for him. So at least game while he's with other people. Maybe he'll make some friends. So something like that where there would be enough of a strong interest that he wouldn't feel as disconnected.
Anything else?
Another possible group for him is children of alcoholics. That would be interesting. I would definitely prepare him for that before he did that. Like, I guess, well, like Al-Anon. He would have to find the right group for Al-Anon.
What about the relationship that he has with his parents? Its current status and the fact that they seem to be the closest people, living, breathing people to him.
It's obviously very important because he doesn't really have social supports. So they don't live in the same household. It sounds like they're have some issues of their own. I think that would be definitely something that I would tackle later on, as long as he's willing to contact them. I would like for maybe his mother or his father to come in with him. Both would be fine, but maybe just to validate that he would tell them if he felt worse or suicidal. But it sounds like they have their own issues to deal with. They're not in the same household, so it would be a little lower on my priority list. Because I don't know if he could really handle that at this time also.
How often would you see this patient in treatment?
Well, I'd like to get a therapist, or if I was doing the therapy, I'd do it once weekly with him. If he's not improving, another possibility is to send him to a partial hospital program. Get him back into going somewhere, kind of like he would when he would be going to work. But that wouldn't be something I would do at this time. If I was just doing the medication, have him follow up in 2 weeks, as long as there's a therapist to check in with him in the intervening time.
What did you make of the comment that he made in their interview about the new monitor?
I'm sorry, I actually don't recall that part.
He was talking about getting a raise, but he had ended up getting a new monitor. It sounded like he had gotten it from his company and had taken it home and was playing video games on it.
Thank you for pointing that out because I wasn't quite sure what he was getting at with that because I didn't quite get what he was saying in terms of they didn't get a raise. I thought at first he said he did this. So if he took the monitor, well, that needs to be addressed. I don't know if there's any other history of any other kind of conduct or antisocial type behaviors that he's had. A good thing to have asked also would be if he had a legal history as well.
I think we're done.
So what do you guys think?
Why did you pick Giordano, and what about schizoid personality disorder?
Yeah, that could be too. Rule out schizoid. Any of the cluster A, right? Any of them would have been. Yeah, I could have said just rule out cluster. It was this fascination with gaming and all that, and just the virtual stuff, and how he's always. That's what jumped out at me. But absolutely, yeah.
I think you have to figure out whether or not he wants interactions to figure out schizoid, schizotypal. That's probably a question that you'd get down the road.
Yes.
What made you decide that paranoia was secondary to the depression as opposed to paranoia being there and then depression secondary to losing his job?
Yeah, no, I that's why I put out the rule out schizoaffective disorder. Just that the paranoia was there, the psychosis was there, and that's. I got the sense that that he was. He was depressed enough that I felt that you just do them just like I did. That's my first line, and then a rule out of the schizoaffective disorder. Maybe I should have emphasized that more, but I definitely, that's why I gave. Also, it didn't have a bizarre quality to it. It was more mood congruent, being persecuted through work, and had that low level kind of related to a mood disorder that would be not picked up. It's more like, to me, like one that's associated with a mood disorder.
What did you make of his acrimony with his parents?
They sound like quite a fun bunch. I can't, the drinking at Thanksgiving, drinking when he's over,
It wasn't clear to me, were the parents actually drinking, or was it just that he was always drinking when he was around the parents? I didn't quite catch that. Okay.
Yeah. I felt he sounded like more like an adult child of alcoholics, like, I'm sort of done with them, that sort of thing.
In a situation like that, would one want to press, even though he said that there was no physical or sexual abuse, given the acrimony, would you want to press on that just a little bit more? Meaning,
Yeah. I would.
Interviewer think.
Yeah, I would. Given more time, I would, and I could have said that when, if I had more time with him, I would have asked him, if they ever did anything while they were under the influence that really was very negative to him. So, it doesn't even, physical sexual abuse is a lot less likely than just being verbally abusive. So.
I think if I was going to press on anything, he struck me as being, I think, more angry and a higher potential for violence to others or himself. That's where I probably would have pressed more, because he just had an angry, and then with a couple of his comments, he seemed very odd and schizotypal, but when he talked about the monitor and talked about getting everything he could out of the insurance, he kind of started having an antisocial flair. And so, considering the job situation and that, I really would want to have been very thorough and explain to them how you would have had some sort of safety plan for him, because, and that's part of why I brought up his relationship with the parents, because that seems to be his link to humanity at this point. These are the people that he came to with these thoughts, and if that relationship is so contentious and fractured, that's probably not the best situation. And so coming up with a safety plan if he decides, driven by his paranoia or something else, that he needs, karma's not going to take care of it, and he needs to take an active role in punishing